Hello everybody, I am Kamal. Today I will talk about one of zoonosis disease, Helicobacter infection. Let's go start. First of all, the definition of disease: it's a bacteria, spiral shape, penetrate protective stomach lining and reduce some enzymes. These enzymes work to neutralize the stomach acidity, which lead to chronic inflammation and open sores called peptic ulcers. The causative agent of this disease Helicobacter pylori. The reservoir and host range, it's depending of a specific Helicobacter species, and there are some species infect various of mammals, but the primary reservoir is stomach human, and there are extra gastric reservoir like oral cavity, saliva, dental plaque. The transmission route to human: there are three routes to transmit this disease to human, like oral to oral, fecal to oral, and gastric to oral. The first one, oral to oral, occur through the exchange the saliva and contaminated food and water by a walker by accident. And fecal to oral occur through the crowded living, bad practice of cleaning, like when hands are not properly washed after using the bathroom and using the restroom. Gastric to oral, it's like through vomiting when you have bits, and these bits infect with this type of bacteria, and try to treat these animals and handle with this vomiting. The pathogenesis of Helicobacter in human and animals. The bacteria tend to survive in this harsh gastric acidity to penetrate the mucosal lining and adherence to the epithelial cell, and resulting some of inflammatory response and gastritis. As you can see here, we have four pictures uh, to four cases. In the first one from left, we can see asymptomatic chronic gastritis, and we can see some of reddish in color, like a protective mechanism from this bacteria. So in the second picture, we can see nodes in lining create from bacteria. So after that, these nodes transfer to gastric cancer and duodenal ulcer as a reaction of bacteria. Clinical signs in human: maybe these clinical signs tend to be asymptomatic, but in some cases we can do like a manifest. You can see this like an epigastric pain, burning, nausea and bloating, and frequent burping and unexplained weight loss. Clinical signs in animal: it's huge, widely depending on type of animals, and like in cats and dog tend to be asymptomatic, but in ferrets come like a severe. In dog we can see like a chronic vomiting, poor appetite and weight loss, diarrhea and dehydration. In ferret we can see nausea and excessive salivation, black and teary stool, poor haircut, severe weight loss and lethargy and dehydration. The diagnosis of this disease: to confirm from this type of bacteria inside the stomach, we have two methods: non-invasive and invasive method. Non-invasive method, it's like stool antigen test, urea breath test and blood test. Invasive method like culture and PCR, histology and rapid urease test. The treatment include 14 days course. It's a combination of antibiotic and acidic, reduce to meditation to heal the stomach lining. We have a three program, and the first line approach Bismus quadrotherapy, which is appear the highest success rate against these antibiotic resistant strain. Bismus quadrotherapy it's include a proton pump inhibitor and bismus subsilicate and subcitrate and metronidazole and tetracycline. The second program is diazoxide. It's a combination of potassium competitive acidic blocker like vanoperazone and amoxicillin. The third one it's rifampicin triple therapy. It's a common alternative for patients without penicillin allergy who can take bismuth quadral therapy. It's a combination of proton pumping inhibition and amoxicillin and rifampicin. The prevention and control of these disease it's like by a lot of procedure, but the important of them like strict hygiene and safe food and water practice and medical education, avoid direct contact with saliva and stool. Public health important because of this disease chronically overthrow the half of world population, and this disease is a primary reason for a lot of infection related with cancer, and this disease classified like alpha group 1 carcinogen, and it's leading to cause peptic ulcer and non-cardiac and adenocarcinoma. And thank you for listening to me.